being protectors of immune systems, working in critical environments, working with so many heroes out there within healthcare facilities, infection control. We've got to take pride in that we're trying to protect people before any wrongdoing kind of happens to them. When I was 17, I was diagnosed with Crohn's disease. It was advanced enough that I had to go in for an operation. I was supposed to be in and out in 4 or 5 days, but I came down with a hospital-associated illness. Ended up having to spend 6.5 months in the hospital. And of that, 4.5 months being fed intravenously, just a really difficult time, to work through and get through. Our jobs are, and connection with what we do is really to try and prevent those type of things from happening in the first place.
Today, Abatement Technologies has expanded from its roots in asbestos abatement to become a trusted partner in protecting patients, staff, and visitors in healthcare facilities and other critical environments. One of our most critical solutions addresses a common challenge in healthcare construction: preventing the spread of harmful particles.
The biggest challenge really is creating and maintaining an effective barrier in order to protect the patients and the building occupants from disease transmission.
When you're building a temporary wall in a healthcare facility, you actually have to put up a vapor barrier to build that wall out of drywall. You have to do all of your cutting and your painting and everything outside of the facility.
Popping a ceiling tile, going behind a wall, those types of activities can disperse particulates that contain either bacteria or fungi. The shield wall really has been an ideal solution.
What shield wall does is it really changes or expedites the ability to put that wall up around that construction space and allow people to get to work faster or create that containment faster. By simplifying the process, having easy to deploy panels.
Air filtration units and monitors can be easily connected to these panels and the system to provide proper pressure and real-time monitoring.
You get a fully finished exterior without having to come back and sand and mud and paint and do all the work that would be involved in creating that finished wall.
So for hospital-associated illnesses, one of the stats that I've heard is the rule of 20. For every 20 people that get admitted into a healthcare facility, one of those 20 will come down with a hospital-associated illness. 1 in 20 of those, it will become deadly.
We're able to build 50 to 60 feet of wall within an hour and no disruption to the end user.
The reusability of the shield wall system is one of the key features of it. Eliminating waste through reducing costs, increasing speed.
You're not filling up a landfill when the project's done, and you can reuse it time and time again.
I'm a big advocate of environmentally conscious decisions, and to be able to reuse and reduce waste by using the shield wall, I think is so important.
At Abatement Technologies, one of our uniques, I think, is our complete set of product offerings. All the containment products, the air filtration, the monitoring, even a lot of accessories that kind of go outside of that. So when we're working with a client, we can really advise and provide solutions on a whole host of applications.
We're very educated, almost like consultants on a lot of the projects. And we really feel like we're a part of your team.
I know I'm biased, but I think we've got a lot of great people, a lot of special people that wake up every day trying to please customers and deliver great value. We are Aire Guardians with what we're trying to do as a team together.
It's really about protecting people and protecting immune systems and being here to help people.